Hello, my name is Shakaya Hawkins, and I'm here to discuss the Georgia Policy KEY 2014 Vaccination Exemption for children between 0 months and 18 years of age. Currently, 46 out of the 50 states allow for parents to have religious exemptions for children vaccinations required for schools. There are several vaccinations that is currently required. However, here's a list of some of those that is required. Today, I propose Georgia ban vaccination exemption for any kind other than for medical reasons. Currently, Georgia has an exemption policy in place granting those who may have religious grounds to have an affidavit signed stating that the required immunizations conflict with their religious belief. However, there is currently no standard form or written guidelines on what or whom can have these exemptions. So, for example, anyone who feels like their child do not need to be vaccinated can simply have this form signed even if they do not have a religious belief. So I propose that Georgia come up with some kind of way to verify that these exemptions is indeed not in accordance with someone's current practices, religious practices. Let's talk about the importance of why we vaccinate. Why we vaccinate? We vaccinate to lower the spread of any and all communicable diseases and maintain a healthy learning environment for our children. Vaccination is also very important and safe. And finally, vaccination saves family time and money. We will later discuss how this is possible in the presentation. Impacts on vaccinations. There are several impacts on vaccination. However, the most important impacts on vaccination is the percentage of current diseases that may affect our kids, that our kids may face while attending public environments. Who would be affected by this policy? Every child between the age of 0 months and 18 years of age. What would change by enacting this policy? The number one change would be the decrease in the number of days a non-vaccinated student would miss out of school due to uncommon illnesses or sickness. For example, non-vaccinated kids are most likely to catch any kind of communicable disease that they may come in contact with, which may cause them to miss at least 2 to 3 days out of school at any given time. However, this is not a very important, or this is not a very good way for kids to have their education. What are the costs? What is the current cost and benefits of this policy and vaccinations? Let's talk about getting vaccinated. The cost of being vaccinated. The cost of one child to get vaccinated is $1.50. However, the cost of one non-vaccinated child to visit a hospital to be treated is approximately $2,000 to $3,000 per visit, given that they are admitted into a hospital. This can take a very big hit on one's pocket, The benefits include, here again, protecting everyone that's around them. Vaccination saves lives. It has been proven that vaccination saves lives. Let's think back to the smallpox vaccination. How many lives were saved due to the smallpox vaccinations? Mumps, measles, and chickenpox. How many lives have been saved for the mumps, measles, and chickenpox? Several lives have been saved due to these vaccinations. Getting vaccinated is key to staying healthy, and it is very cost efficient. How is it cost efficient? As I said before, it is cheaper to prevent a disease than to treat it. What are the risks of enacting this policy? There are several risks that come into play with this policy. However, the risk is not that high. This policy will lower the chances of anyone getting sick. Also, it'll be a way for the CDC to have control over what may cause a outbreak of any sort. How will the lives of people that are affected by this healthcare issue change if this policy is enacted? This will change their lives dramatically, but only temporarily. I say that because once they finally realize how this change has decreased the number of illness that their child has not gotten, then they would be very appreciative of this policy. So I come to you today asking that you all consider banning this exemption policy to not only keeping our schools safe and a learning-free environment, but we also take control over the communicable diseases that our kids come into contact with on a daily basis. Thank you and have a great day.